Hi there, this is Risty with Theramax. I'm going to show to you the evaluation for the supervising therapist to request for the auth for the pediatric patient. So for this example, we have a chart of the patient name Home Health Risty 1 training, and if you can see here, this is the chart of the patient. So we have here on the plotting, we have the physical therapy evaluation. That if you're a physical therapist or occupational therapist, it will be plotted in the OT or ST here, but they're all the same evaluation for new auth and whatever insured with that. So you're gonna be filling that out. I will advise you to create a template for you. Like for example, for my side, I'm a physical therapist and I'm doing documentation right now. So I will be opening this link, and then of course here, right, I created my own template. So I will not gonna be discussing, this training is about the addendum and how you incorporate that for your physical therapy or for a therapy evaluation. Doesn't matter, re-evaluation for a new cert, for auth extension, or for the initial evaluation. But you're gonna be creating an addendum as part of the documentation to justify the medical need for the child for therapy. So for my side, I have a template which is very easy to create. So I have a template, for example, for pediatric decreased muscle strength and decreased range of motion. So this is only an example, okay? So an example, so there it goes. So it comes out like this. This is also a template. This is very important for us to include this template. You can ask the SC, but this particular template, we need to put the case, a gender, what language, date of birth, the age, and the medical diagnosis here, which is also here that you can get from the patient's chart. And then if the patient has a therapy before and other medical history. Okay, so saying that, so for example, this is only example, I can put 11 to 11:55, right? And for today is the September 18. So assuming you did everything here, there is important thing that I need to discuss is below here on the clinical statement. So on here, I used to have a template because I use this for my evaluation. But to help out everybody, it's easier. So what we do here is we just put here, I'm gonna start deleting this with all my template. I'm just gonna put here, please see addendum on today's date. Okay, so you don't need to write anything here, so just write as normal, except that here, please see addendum on today's date. And then you put the goal and everything, whatever you write here, put the goal, okay? And the frequency, I will say always put 2 to 3 times a week, even if you feel like it's 2 times a week, because in case there's a missed visit that you can legally make up, then the plan of care covers the visit, okay? So anyway, so let's save here. So let's assume we're done here, okay? So we save and submit, okay? Now, we're done. We're gonna be closing this, so we're done with the evaluation. The next thing we're going to do now is we're going to go to the next task, which is the addendum. If you can see here, it's already saved, right? So this is a training purpose only. So in reality, it's already submitted. It's already submitted with signature. So next thing you need to do, remember on the narrative side, you said, please see attached addendum for today's date, so 4/18. So you need to open this, and this gives you the, of course, I'm sorry, you need to open this, of course, first, and then depending on your profession, okay, so you put the date here. The date here is you just uncheck this, but it doesn't make a difference, but there's no reason for you to be sending it to everybody. So you put the date of your evaluation, and automatically the system will give you the patient physician. And here, this is what I'm trying to show here. Since you're doing an addendum, you need to remember what addendum are you trying to do and what special test. If I am a physical therapist and I'm doing a special test for BOT for my patient, I'm going to use addendum PT BOT. So if you're creating an addendum and you're an occupational therapist, of course you would create OT and what kind of special test. The same thing with a speech therapist. Okay, so I'm a physical therapist. I'm going to create a BOT addendum. This is what I used for my special testing. So if you can see here, this is already it's not self-explanatory, but it's already filled out for you. So if you can see filled out for you. Here you can it says here copy and paste from the IE the re-eval medical history. So you can actually delete this, but if you want, you can also copy and paste the medical history that you just write in the in cancer evaluation. So either way, so for me, I don't want to redo it, so I will delete it. You can delete this template. Now let's go here. It's already here. Everything is here. This is something that you don't need to do anything. All you need to do is fill out this score, this one. See, BOT was administered to the above patient, named patient, and following scores were obtained. So all you need to do is fill out this score. Okay, total point score, standard score, percentile rank, in the descriptive category. Okay, that's the first thing you need to fill out. The second one is this second part. You need to put the narrative summary, and then you can put the answer here. There's a guide for you, safety risk in relation to the current functional limitation. You can answer this guide. If you're not comfortable having this questionnaire there, you can delete it if you want to. You can delete it, or if you wanted, you don't want to delete it, you can just do that and answer the question each. So either way, personally, I delete it. So I will answer here in the top, and after I'm done, I will delete it. Like that. The next one is here, the previous or the last re-evaluation as progress, the goals. You need to copy and paste here the goal of the previous cert, and of course the update. So if what's the update, you put the date today, and then the update if how many % goals met. And then after that, this is also self-explanatory, a reason for physical therapy needed, and then you put here A, B, C, and D. And then number 5 is you put here the recommendation. These are all only a template, so you can delete this. But personally, I will leave this one like that. I will like that, and then I put an answer and put the frequency like that. Okay. So it's up to you. This is a template for you to follow, but I will not gonna tell you what to write here. But this is a template that we use for making sure that we get approval for the child's authorization. Then here, this is something that I put here, but you can change it too. And the next one is you can read this, you can change it if you want to, you can just delete it if you want to, whatever you want. Okay. And then the current goals, you don't need to write anything on number 8. It says here, medical reviewer, please see and attach eval on today's date. And then that's it. You can delete this, and then you sign and you save. So once you submit it with signature, it shows here, right? But since it is a training, I'm not submitting with signature. But let's take a look at how it looked like. So when you're done answering, this is how it looks like. And what we're going to do with this is we will be sending this to the insurance company in addition to your evaluation. So if you have questions, please call QA department and look for the QA ahead for explanation, or you can request for more training from us. Thank you so much.